My favorite part. I get to hear from some of my lovely patients. And Wendy, thank you for stepping in as well to be a patient panelist. So I will introduce Jeff Kennerly and Marian Piniella and Wendy Borsari, of course, as you know. And we'll start by just having each of them give a kind of a brief summary and introduction, who they are, share as much or as little as you deem necessary. And Jeff, should we start with you?
The way I was raised, ladies. So.
Oh, a true gentleman. Thank you, Mr. Kennerly.
I'm in the middle and I'm being told I have to go first. So I'm Marian Piniella. Can't hear me? Is that better? All right. I'm Marian Piniella. I'm actually an employee of the University of Pennsylvania. And I'm tied into medicine, and at a routine visit, it was, should I go into that, or should I wait? Okay.
Yes.
I had a routine sick visit, or so I thought. A doctor heard a heart murmur that I had never had before, except that I developed during pregnancy, and fast forward to 2.5 months later, I'm sitting with Amy and Dr. Owens, and I'm told I have hypertrophic cardiomyopathy, and about 30 days later, I got fitted for a defibrillator. And here I am today. I have 2 gorgeous biological daughters. I also have a stepdaughter. My kids are screened here at CHOP by Dr. O'Connor. And I am I'm an athlete. So I recently met Dr. Day at work, and it's been awesome. There's a lot of really good resources that I've found, and I am my biggest advocate for HCM. My entire family, it turns out, is plagued with this disease, and I had absolutely no idea until that random day in March when I met with Amy and Dr. Owens.
Tell us a little bit about your family history, which I think is so incredibly important about you and your story, is how big your family is and how the screening process has happened, and perhaps that you might have a relative in the audience.
Is he here?
Oh, he's here. 2 relatives in the audience.
So my father's family is ginormous, and I honestly, my cousins are probably should be up here more appropriately to discuss the family history. But my dad's side of the family, we've had sudden death, we've had transplants, we've had multiple of us have defibrillators. The list goes on and on and on. From my understanding, we're one of the largest cases of HCM in the world, which that's my claim to fame. And my dad actually had 2 heart attacks, and HCM was never detected. So until this day, he has still not actually been diagnosed with HCM, but we know that because of his family, my genetic testing, that actually was the identifier of the correct gene that my family carried, my genetic testing was how we were able to figure out exactly what gene that was causing HCM in my family. I had no idea any of this existed. I actually got an email saying that a cousin of mine had a heart transplant, and I'm like, oh my God. Like, I emailed them back and I'm like, why? Does he have HCM? And they're like, yeah, it's the Capelli curse. I'm like, what are you talking about? I had no idea it existed. And it literally, my family is plagued with it.
So it's actually called the curse, right? The Capelli curse, is
it? It is. And I didn't meet with the same genetic counselors that I also have 6 brothers and sisters. Unfortunately, my oldest sister, who we suspect had HCM, she's no longer living, didn't die of anything related to the heart. I have 4 brothers and 2 sisters. Stubbornly, 2 of my brothers have not had testing, and one of my brothers has had the testing. He also has HCM, and he's currently being treated here. His children have been screened. My other brother, he does not have HCM, and either do his daughters that we're aware of. They've not had genetic testing, and they're not doing that. My sister, she has not had the screening yet, and I hope she'll be coming soon. So yeah, it's everywhere. It's truly, I mean, my dad, I believe there were 15 aunts and uncles. And it's just growing. The geneticists at Penn have a map of our family history. And my brother said it was probably one of the most incredible things he had ever seen, because Penn and Chop know more about our family than we do.
Which is a recurrent theme. So that pedigree or that family tree that we put together when we meet each of you and learn about your families is really kind of our key on our map, our roadmap, if you will, of knowing who's at risk, how do we keep them safe, who needs their heart to be looked at, and how frequently. And we layer on top of that the genetic testing that we might do for your family to put our finger on the marker, the genetic marker. And in a family like yours, it's very large. That marker is really critically important to say, do we think this is the cause of disease? Because then you can stratify people into high risk, even if you're young, if you have that genetic change, we know we need to follow you closely over your lifetime. Or are you not at risk, 50-50 chance? And if you didn't inherit that marker, we might be able to dismiss you and say, you don't have to have your heart followed for the rest of your life. So in a family like yours, Marianne, it's been very helpful to have that genetic information. And from our side, we find out that people related that we didn't know, that have different last names, they're coming from different areas. And we say, oh, these people are related, and it's one big puzzle that we try to put together. Thank you for sharing that. So, Jeff, we'll let Wendy go next, unless you're ready to jump in.
I'm fine. I can go.
Okay, we'll have Jeff.
I didn't know. You have a similar.
fine.
Okay. Again, Jeffrey Kennerly.
Bring it.
Oh, Jeffrey Kennerly. All right, let's go here. All right, there we are. So again, my name is Jeffrey Kennerly. I am new to the area. And it sounds like you guys are much further along in terms of the genealogy of your family in terms of mapping it out. My path is just starting. So the 17th, so next Thursday will be a year to the day where I went into an urgent care in Virginia to talk to someone about just feeling a little weird, literally just sitting in my office. I was like, I'm a little lightheaded, had a couple of meetings that morning. So let me just run to urgent care really quickly. I go in, and I'm sitting across from the doctor, and he's looking at me like I have 3 heads on. I'm like, Doc, what's going on? He's like, I'm trying to reconcile what I'm seeing in your chart and what I'm seeing on the monitor and what I'm experiencing from you right now. I was like, well, what do you mean? He goes, okay, fine, I get that you were a former athlete. Oh, I was like, me. I'm like, once the athlete, always the athlete. But I'll let you keep that. He goes, understand you were an athlete. So, and you historically have had a low resting heart rate of, call it high 40s, 50. And that's probably because you're strong heart. You're good. You're okay. He's like, but what I'm looking at right now, I believe he said your resting heart rate right now is registering at, call it 38 to 42. World-class marathoners can only go down to like 45. I'm far from that. And so he goes, you're going to ER. So I'm in Northern Virginia. I go to Inova. And again, I'm like, I'm fine, Doc. I had my buddy come pick me up, like literally my business partner. I was like, he can come pick me up. He would drive me to the hospital. He was like, no, you're going in a bus. You're not out of my care. And that ensued this process. And I came to UPenn to get a second opinion. And Dr. Supple literally was like, yeah, you need a pacemaker. And the only question is whether or not you need a defibrillator. That was the question, whether or not I need a defibrillator. And that happened. So November 5th, which was 6 weeks to the day my mother had her pacemaker put in, I had the defibrillator put in. And so having conversations, trying to figure out how my particular cardiomyopathy was showing. So I had a dilated fuse.
Dilated cardiomyopathy.
Dilated cardiomyopathy that's triggered by a mutation in the Lima gene, or lamin gene. And so mine shows very differently to my mother's. My mother's one shows in the muscle.
Mom's here, by the way.
My mother's there.
Hi, Mom.
It shows in, hers shows in the muscle, mine shows in the electrical system. And so then became the conversation of, well, where is this coming from? Let's talk about genealogy. My grandmother, my mother's mother, had 2 heart attacks. She passed away. And so the thought probably is it comes from that side. Father's side of the family is he's one of 17. If we had a family reunion in here, we would probably fill this room and the next room over. And so it's interesting starting to have that dialogue with them about what do you need to be paying attention to. They've had conversations with me. How did you know to go in? And so we're just like I was saying, we're on the beginning of that path of trying to figure out, is this something that we need to be mindful of on both sides of the family? And yeah, they've been great. This has been probably one of the, in terms of care, I've appreciated the level of attention and the patience they've had, because I asked a lot of questions. And I pushed the envelope a little bit. So I'm like, well, do my kids need to get it? I'm thinking about the whole insurance thing. The area in which I work in, the industry I work in, it's all about mitigating risk. And so thinking about that for my family is paramountly important.
Jeff is a businessman, in case you can't tell. He's the only patient to date that has asked me, so if we leverage this ACE inhibitor, and I was like, oh boy, what will happen? Thank you, Jeff. Wendy, we're anxious to hear your story.
Hi. So my name is Wendy Boyd. I'm a 53-year-old mom of 2, and I was diagnosed when I was 24, so I've had the condition longer than I have not had the condition at this point. I also have a large family history of HCM, not as many members of my family, but almost full penetrance. So everybody in my family, we haven't had the luck of having the 50-50 where we've had most of the people, or half the people in my family not born with it. I think of cousins, first cousins, second cousins, all of that. My brother's the only one that wasn't born with the gene for the condition. So both of my kids have HCM. My son was diagnosed when he was 15. My daughter was diagnosed at birth, so within just a few hours of her birth, she had an echo, and they saw the thickening at that time with her heart. I have a pacemaker defibrillator that I got my first one 2 years after my diagnosis, so I'm on, I think, my 5th one now. I'd have to count the scars. So luckily, mine have never fired. It's always been just kind of precautionary. I have them in there just on the off chance that I do have, either a slow heartbeat. They pace me every now and then, but I've never had have it actually fire on me. My daughter is much more seriously affected, obviously, like the slide showed. If someone is born with a condition, typically it's a more serious condition. When she was just after kindergarten, so she had just turned 6, she had a myectomy, and surgery went very, very well. When she was 14, she had her first sudden cardiac arrest. That was actually a commotio cordis event, so that happens when you have a strike to the chest that happens right between 2 heartbeats, and it throws off the rhythm. So the doctors at that point had no idea what to do with her, because they really thought it was due to the strike to the chest, not due to her hypertrophic cardiomyopathy, and there are no studies out there on kids with HCM who have a commotio cordis event. So they sent her home after a night at the hospital. 2 years later, while she was in dance class, she suffered 5 additional sudden cardiac arrests. She's fine. She's alive. She survived them all. Her heart was going into bradycardia, which is the slow heart rhythm, not a tachycardia. So she needed a pacemaker as well, where she went into complete heart block, and her heart actually stopped completely during 2 of those cardiac arrests. Obviously, she didn't leave the hospital that time without a pacemaker defibrillator implanted. So she has that now, and she's doing well with that. My son, he is 19. He's in college now, freshman in college, so I have to deal with that whole thing, having the first of my babies leave the nest. Luckily, he went to a school that's only an hour and 20 minutes away, so we can see him whenever we need to. He has not ever had really any symptoms so far with his. He is having some symptoms right now, so he's going in next week to see his cardiologist just to see if they're just the exercising that he's doing, maybe he's pushing himself a little bit too hard, or if it actually does have to do with his HCM. But otherwise, he's pretty good with it. So, and with me, I'm on a lot of different medications, but the medications are doing their job. So most of the time, I have more good days than bad. I do exercise a lot. I started exercising after I read Dr. Charlene Day's study. Before that, I didn't at all, and it has made a huge difference in my life. So, thank you to the research that's happening. But other than that, it's a day-to-day thing. I help organize conferences now like this because, I just think education with any condition like this is so important because that's when we really can advocate for ourselves. And I think it's really empowering when you know more about what's going on with your own body. So anyway, that's my story in a nutshell.
Thank you. Let me open it up to questions. Any comments or questions for the patients? Yes. Cardiomyopathy in general is an equal opportunity affector. So both men and women. There could be a number of answers to that question. What do you think? I'm glad you said it and not me. Jeff, what do you think? Why there are more women than men?
It's funny. Like when I brought it up, so I work at a firm, and I had this episode. I literally people saw me in the office, and then all of a sudden I'm gone. And when I came back, and I told leadership, "Hey, this is what's happening." I kept them abreast of it. And when I came back, there were two other colleagues of mine. One who is since retired, and one who was maybe 5 or 10 years older than I am, who have both had who are living with cardiomyopathy in different stages. And so I think part of it is, like, I was upfront about saying this is what's happening to me, right? And so one, it's a surprise factor because everyone's like, Jeff, you're too young to have a pacemaker. Two, by me having the conversation and being open with my colleagues, it gave them, the men, wanting to come in and talk to me about, like, well, what's been your experience? And so in both instances, they'd come to my office and said, hey, this is, how was that experience? I'm getting one right. I've been having conversations with my cardiologist. You had an ablation done. What does that do? How did you feel after? And so we had an open dialogue about it. So I think that, I don't know if men typically don't have that open dialogue about stuff like that, right? And so we don't necessarily have to go to the doctor. Women go to the doctor more, but that's honestly, like, women are brought up to, you go to the doctor, your OB, like, you have things that you go to regularly. Guys, put some dirt on it, put some water on it, and go back out and do what you have to do.
Unfortunately, the women are bringing their males to the.
There's a cultural, now they are, but I think culturally, I think that's the way we are. Culturally, there's a culture in the U.S. where that we just have to tough it out, and I think that may drive why maybe they're not here. Maybe they don't want to realize it. I don't know.
Yes, comment. Sure. So a pacemaker in general is something that's there to help your heart beat if your own electrical system goes too slow. So for someone whose heart rate is lower than it should be, and the electricity usually travels from the top of the heart into the middle and then to the bottom. So if you're having trouble with your own impulse and it's going too slow, then a pacemaker, which is a wire, can be put into the heart to deliver that electrical start, that impulse. And then your own electrical wires, if you will, can carry the impulse. If you have a problem throughout your electrical wiring, then you may need 2 wires to make the top part beat and then the bottom part beat. And if you have a certain kind of heart failure where the heart's very big and weak, you might need 3 wires to make the heart synchronized or squeeze at the right time. That's a pacemaker. Defibrillator, in general, is something that's put in to protect you against very fast heart rhythms that might make you pass out or even die suddenly. And those fast heart rhythms come from the bottom chamber of the heart. And the heart beats so fast that it's not able to pump blood out effectively. So this is not atrial fibrillation, which comes from the top chambers, but rather ventricular tachycardia, or VT, comes from the bottom chambers. Very, very fast, 220 beats per minute. No blood can get out to your brain, and you can pass out or die. A defibrillator is either a wire that sits in the heart, or the newest defibrillator doesn't have a wire, but has a box that's under your chest. And the whole goal is for that wire or that box to watch you. And if you go into that life-threatening, very fast rhythm, it activates by giving you a shock from the inside. So like you see on television with the paramedics who put the pads on the outside and deliver a shock, this is a shock from the inside. And it resets your heart rhythm so that you go back to the normal system. That's an ICD. That's correct. So an implantable cardioverter defibrillator. So that's defibrillator versus pacemaker. We have fancy devices that can do both. Combination pacemaker defibrillator. And we're happy to talk in the breakout sessions. Dr. Jansen and Dr. Frankel will be here. They're both electrophysiologists. Dr. Frankel's on the adult side, and Dr. Jansen is on the pediatric side. They're going to bring some devices. So you'll be able to hold a pacemaker if you choose, or a defibrillator, and take a look at them. Other questions or comments? How are we doing on time? Are we getting close to lunchtime, speaker? One more comment. Thank you.
Yeah,
I
maybe
wonder.
One more question.
One more question. Go ahead.
So, right. So, my 5 changes, it's the battery that is being changed. And the battery life has gotten longer. So when I first got my first one 24 years ago, the batteries only lasted 4 to 5 years. That one also had a lead that ended up fraying, so I had to have a lead extraction. So each time I've gotten a new one, it's almost just like it's the battery pack. I mean, it doesn't do too much, so now they're lasting longer. So the one that I have now, I think I've had for like 7 years, and it still has a long battery life. But that's what I mean by change. The same wires otherwise, but this different device.
Great question. So when you need your generator or your battery changed, they don't usually have to go back into your heart and do anything to the wires. It's still a procedure. It's still an invasive procedure. They have to cut your skin, but it's more straightforward in that we're changing out the battery, but leaving the rest of the hardware in your heart. And we are going with newer and newer devices so that we don't have to put things inside your heart. Because if they break or they become infected, it's a lifelong thing. We're moving to defibrillators and hopefully in the next few years, pacemakers that are all outside of the heart. And we should probably stop there then and get ready for lunch.
Yeah.
Thank you so much.
Thank you.